test, but you didn't have it. Okay, who wants to check out the backyard?
For a list of tests every man should have, go to ahrq.gov.
Mark! Anna! Hey, forgot your lunch. Hey.
You don't have to be perfect to be a perfect parent, because kids in foster care don't need perfection. They need you.
Welcome back to Health Talk. I'm Pat Pingatore.
And I'm Sal Shalero. Today we're talking about advances in plastic surgery. Our guest from Sound Shore Medical Center is plastic and reconstructive surgeon Dr. Rafael Magana and Dr. Dominick Golio, a clinical assistant professor of surgery. We had some really interesting conversation
during the break.
Off air during the break. Now we have to share with our viewing audience. I didn't know that this came under the heading of plastic surgery, but these two guys remove hair and replace hair. Tell us about some of the work you've done in that area.
It's something that we do usually with laser treatment. It requires several treatments. The darker the hair of the individual, the easier it is to get rid of it. Lasers target that follicle because of its color. It's called a chromophore, and so when we target it, we can actually burn it. And hairs have cycles; they're not growing at the same time.
So you're removing the root. This is not going to grow back.
We're ablating it, destroying it, and so that requires a few cycles because the hairs don't grow at the same time, and so 3 or 4, sometimes 5 treatments will get rid of a substantial amount of bothersome hair.
Can you do it for very fine hair on the face, or does it have to be a little coarser?
Usually the coarse hairs are the ones that are more susceptible to this kind of treatment, but we use IPL for that as well, and that's effective. And we also do hair implants, aside from the removal. So that also is
I never knew that came under the heading of plastic surgery. Wow.
And do you use, what kind of results with hair implants, and are they basically men, or now are they men and women that have this procedure done?
Mostly men. What would you say? I guess 90% would be men.
95.
Yeah, I don't think women are as informed about this procedure, or don't know it's an option for them as much as, and don't seek it out as much as men.
Because we've had a dermatologist on before who does say that is a real problem with women now. Thinning hair, I don't know, it's because we're living longer or stress, whatever, but that she sees that as a problem.
I read where baldness is fairly common in women.
It is.
Yes, it is.
But women also have more options available to them, such as the weaves and things like that, where men who have
wigs.
Even wigs.
The wigs are so good today, you don't even know.
Exactly.
I could never tell that was a wig.
But in terms of, but for women, there's a lot more options than there are for men, because men usually wear their hair short and very difficult to make any additions to short cropped hair.
Yeah.
That's true. That's true. Women's just with the extensions, it makes it look.
Exactly. You can get a lot more volume that way.
Okay. Do you want to move on? Let's move on to breast surgery.
Yeah.
So you can do breast enlargement, reductions. Talk a little bit about some of the advances in that.
One of
Absolutely, yeah. In the last 10 years, we've had many more advances in both what we call autologous and prosthetic reconstruction. Autologous is anything that's from one's self. And so we used to do something called, and still do, something called a tram flap to reconstruct a breast.
This is after a mastectomy you're talking
After
about?
a mastectomy, yes. And that would include part of the abdominal muscles rotated up to create a breast. And that had the advantage of looking very natural. However, it did have the disadvantage that with time you were more susceptible to having a hernia, a weakness in the abdominal wall where you took the muscle from. With time, this science has evolved, and now we're just doing something called perforator flaps, DIEP flaps, which do not sacrifice the actual muscle. They only take the portion of the tissue, the fat essentially, that we would have otherwise discarded in, say, a tummy tuck, we use that to reconstruct the breast, and that gives wonderful natural results. That's autologous surgery. That's where we've come to. That's state of the art. SIEP flaps, DIEP flaps. And also, a popular modality is prosthetic reconstruction, which is using expanders and then a prosthetic after an implant, rather, to give a permanent breast reconstruction result. And that's also very favored.
What's the lifespan on something like that? How long would something like that
With the
last?
newer implants, the cohesive implants, there is no set deadline of when they have to be changed, or there's not enough studies. to tell us
Years
that.
ago, there was a
Years
certain
ago, it
period
was
of
10
time they had to
years.
change.
Yeah,
Okay.
10 years.
These are saline implants, is that
These
what
could be either saline or silicone. Almost uniformly, women are more satisfied with the silicone implants.
Oh, really?
Wouldn't you say?
Yeah.
Silicone's- yeah.
More natural result.
Yeah.
And I would, years ago, I don't think as many women who had breast cancer had reconstructive surgery. Now you hear it all the time.
Yes.
And they have it very soon.
It's synchronous. We try to do it at the same time to reestablish that feeling of femininity. They don't want to lose that for an extended period of time. It's better to do it at the same time.
I've been hearing a lot about rejuvenation hand surgery, that people can tell your age because your hands look so old. Have you been involved in some of that?
It's actually on our blog, but yeah, we have. What's your favorite for
One of the things, I think the hands have to be approached in two different ways. One is for the skin, and the second is the soft tissue underneath the skin.
Okay.
So a lot of people will have age spots.
Right.
IPL is an excellent option for that, to help get rid of and even out the skin tone. After that, dermal fillers are also very good, or fat transfers. Will harvest fat and inject it into the hands, and that will give you that nice youthful appearance where you don't have the very, as women describe it, veiny looking hands. So we actually take a two-fold approach, two-step approach to it.
That's pretty common. A lot of people are so concerned with what their hands look like.
It's
they
the
would go through
one,
surgery.
the one defining, yeah. It's
Wow.
it'll give it away.
Could just wear gloves. Just ask.
Okay, we're moving on down the body. Liposuction.
Yeah, we're big fans of it.
Okay.
I think it's one of the most common procedures. Tummy tucks.
So we're candidates for everything.
I know,
Liposuction.
I'm taking inventory here and I
I'm
have
a
to check by
candidate
every
for
box.
everything.
There are many modalities of liposuction that have come out in the last few years. After trying them and reviewing the literature, my preference is ultimately to use the traditional liposuction, which is the safest. Just the traditional, without using any laser liposuction, etc. Although these things are used commonly and are effective, but I don't see any benefit of these new technologies, any real studies that demonstrate.
What exactly is liposuction?
Liposuction is a procedure in which we infiltrate a large amount or a significant amount of fluid, tumescent we call it, and then we selectively take out that fat. We suction it out and liposculpt the body to give it a more pleasant contour.
Okay, now, silly question. You take it out. But the causes, the reasons why it got there in the first place is maybe my diet or not lack of exercise, whatever.
It's a variety
so if
of
I
things.
continue
Yeah.
those things, is it not going to come back?
Or come back in other
No.
places and it's going to look funny.
Right, it will usually come back once those fat cells are typically permanent. Once you remove them from one area, they usually do not return.
Oh,
However,
okay.
if you do gain a significant amount of weight, you can have an induced contour deformity. For example, if someone gains 50 to 75 pounds where they had previous liposuction, the liposuction that was done at that time was for your weight when you had it done. However, if you gain a significant amount of weight, you can now develop these deformities because the fat cells will just enlarge.
Okay, aside from gaining 50 or 60 pounds, is there some exercise regimen that you would prescribe for someone who had the liposuction to prevent it from coming back in that area, if it was around the waist, for
I
example? or
think
something?
lifestyle changes in general are very good. The diet clearly is something that we all know impacts a high carbohydrate diet is terrible. And I think also stress is very important and a very important factor. People who are more stressed, secrete more cortisol, which is a hormone that ultimately induces obesity, depression, stress, that kind of a thing. So it's several things. It's a complex kind of a picture. But I would recommend that just general daily exercise and a good attitude help. You know.
I've read something about cool sculpting. What is that?
You may be referring to this thermage. Thermage is a technology, is radio frequency technology that essentially uses a probe to superheat the deeper layers of the skin. And what that does is tighten the deeper layers of skin, and it actually cools the more superficial layers of the skin so as to not damage them. And it's an effective treatment. It's one of those non-invasive treatments that we use to tighten up the facial skin or abdominal skin.
So it's not liposuction?
It is not liposuction.
Oh, okay.
No.
Okay.
We keep moving around the body. I also read about arm lifts and thigh lifts, and how common is that? Is that in older people, I would imagine?
Older people, typically patients who have had bariatric surgery, who have a significant amount of excess skin.
Right.
Those are...
Now that leads maybe to another question, which you can answer all at the same time. I know because we've had bariatric surgeons on the program, and part of the problem, or part of the issues, is after the surgery, you're left with all this loose skin, which at one time was considered cosmetic surgery and not covered. But now I understand it's being reconsidered as maybe necessary surgery that's part of that bariatric procedure.
Yes.
Yes?
Yes. When you have excess tissue that drapes over other tissues, and you get humidity building up, you get infections, just discomforts of that sort, those are things that are considered medically necessary to correct. So we perform paniculectomies, which is essentially taking part of the abdominal excess tissue off, breast lifts, because sometimes you get what we call ptosis, which is droopiness of the breast, and that sometimes is not only unpleasant for the patient, but it's also uncomfortable to wear a bra, etc. So these things, if properly documented, may be covered by insurance.
Okay, we have about 2 minutes left. What do you expect to see in the field of plastic and reconstructive surgery in the next 5 years? We've advanced so much. What's coming down the pike?
I think there's going to be more the continued trend towards minimally invasive surgery. I think the other thing that's going to really be focused on in the next several years is rebuilding the soft tissue, the deep soft tissue, the subdermal layers. For example, we're using that now, fat transfers to the face, to help augment the volume. One of the things I always tell my patients is youth is volume. If you ever look at small children, they have very round faces with a lot of subcutaneous fat. Exactly, and that's a youthful look. So I think the big focus will be on autologous fat transfer that you take after a facelift, and you'll basically give yourself some more volume to the face.
So you'd be taking it from one place and putting it somewhere else? Mm-hmm.
Well, you guys are young, so you're not operating on each other yet.
We're 60 years old, and
well, maybe they're older than that, and that's why they look so good. Maybe. But anyway, we had that. I think that's a pretty good idea for a before and after show. We'll look at us now, and then
when you come back,
we'll go through all these procedures that we just talked about, and we'll come back in 6 months and see if anybody recognizes us. But thank you both for being with us. We appreciate it.
Fascinating information.
Thank you.
Most enjoyable. For more information on plastic surgery, talk with your healthcare provider.
If you have either a question that you would like answered during a future Health Talk or a topic suggestion, please email us at healthtalk@sshsw.org. Join us next week and every week at this time when Sound Shore Medical Center presents health information for your good health.